strange is true, the story of object relations. Object relations is a very important area within psychoanalysis. And today we'll go into first the definition of it, and then elaboration of it, and then link it to psychopathology. So let us start first with why object relations is so important to study. One way to divide all schools of psychoanalysis into 5 categories is to divide them into the drive schools, object relation schools, ego psychology school, self psychology school, and intersubjective school. And each of these groups can have within itself multiple schools separated by a small nuance or a small disagreement or emphasis on certain concepts. If we take example, Freud's school is a drive school. The idea of psychopathology there is that psychopathology essentially is a result of frustration of a drive. So there is a drive and there is a repression of the drive. And this situation results in a frustration whereby this drive goes into some vicissitude leading to a symptom. So what is important there is drive, satisfaction, and dissatisfaction. The second group of schools in psychoanalysis is covered by the term object relations. The foundation of object relations movement was laid by Melanie Klein. And if we look at object relations school today, we see Klein, Winnicott, beyond. Winnicott would call himself independent, but we will see later how Winnicott school can also be put under object relations. So if we look at the drive schools, we have the Freudian school. Object relations school, we have 3 schools, Klein, Winnicott, beyond. You can actually put 2 more, Kohut and Lacan. The third category of schools is what is called ego psychology school. That school is based on the work of Hartman and Freud. Fourth is the self psychology school based on work of Kohut. And then we have intersubjective school, which is based on work of, which are the schools which are based upon work of George Atwood and Robert Stolleron. So we see that object relations is a very important category of schools in the canvas of psychoanalysis, and therefore is very important to study. Another way to go deeper into the object relation schools is to divide all object relation schools into 2 categories: the hard object relation school and the soft object relation schools. The hard object relation schools are those which specifically and explicitly deal with object relations using the terminology of Klein of object relations. And here there is a difference, right? If we look at hard object relation schools, one classification people make is to put Klein, Freud, and beyond into the hard object relation schools. Which is surprising because Freud, logically speaking, should not be here. He comes from a drive school. But this classification, those who use, they say that the drive is towards an object, and it's very clear that the object and the way object relates to you is implicit in the drive school. So this is a point where one may not agree, but this is the classification some people use to say there are hard object relation schools and soft object relation schools. The hard ones are where we have a clear emphasis on object relations in the real world, and the object is by and large referred to as the object. You don't go into something which is far away from the object and describe a phenomena in a way that you don't use object relations terminology. But if you go deeper into the phenomena, you realize object relations is at work. Those schools will be the soft object relation schools. Like Winnicott would talk about good enough mothering, but this good enough mothering experience is an experience of object relations. Kohut would talk about many things, including mirroring, idealizing, empathy, based upon the experience of the infant in early childhood with the caregivers. He would not so specify the caregiver as a mother like Winnicott does, but he would just say caregivers or the environment, and therefore in Winnicott and Kohut, we don't find the terminology of object relations, but if we analyze the phenomena that they put emphasis upon, we realize at the core of it, it is object relations at work. So they may describe it in a different way. They may operate at the on the phenomena at a higher macro level rather than a micro object relations level. But object relations are implicit. Even in Lacan, this also some will find it difficult to accept. These two, Freud in hard part and Lacan in soft part. But the justification given is this, that in Lacan also, the small other and the big other are very important. And the small other and big other obviously are objects. So one way to classify the entire object relations schools is to classify all object relations school into hard and soft. In hard, we can put Klein, Freud, and beyond. Soft, we can put Winnicott, Kohut, and Lacan. If you find it difficult, you can remove Freud from here. And you can remove Lacan from here. So then what remains is, in the hard part, you have Klein and beyond. In the soft part, which is Winnicott and Kohut, which seems a very clean classification. But this is the alternate view of the entire object relations area from inside. So when we look at psychoanalysis, we have 5 groups. One group is object relations. When we go deeper into object relations, there are 2 views of hard and soft. One view puts Klein, Freud, and beyond in hard, and Winnicott, Kohut, Lacan in soft, and the other view puts only Klein and beyond in hard, and only Winnicott and Kohut in soft. So there are 2 alternative views of classifying object relations as an area from inside. Now let us come to the definition of object relations. We have 2 words here, object and relations. So let us start with the first word, object. Let me go through this slide, not to confuse you. So let us start with the first word, object. In colloquial language, object means something that you see before you or something that is tangible, that occupies space as weight. When we use the word object in psychoanalytic sense, specifically in a Kleinian sense, we not only include the real life objects, the physical objects, we also include non-physical entities. And we also include psychological entities which are inside of us. We also make a point that entities outside are represented in the inner world in a specific way, based upon our experience and our perception of those objects. So the outer objects have a representation in the inner world, and because the inner world also has a very strong function of fantasy, the inner world creates its own objects or modifies the outer objects by the function of fantasy. So when we say object, we mean not only objects of the physical type, we include all external objects and we include all internal objects. So the use of the word object is extensive in its scope. In a epistemological sense, especially Kantian sense, we have this dichotomy of the subject and the object in the process of knowing. The use in psychoanalysis is slightly more complicated. So, when we psychoanalytically get into analysis and we use language, we might treat the subject also as an object. So we are thinking about the thinker as the thinker was at a particular time in the past, or it will be in future. So when we use the word object, it is different from normal use of the word. Similarly, when we use the word subject, the subject is the one in whom object relations are happening. Or you may say subject is involved in object relations, or in a Lacanian sense we say the subject is itself a falsehood in the face of primal chaos, and in the primal chaos there may still be objects, and the relation to the objects may be both linguistic or pre-linguistic, or of such traumatic affective nature that language is not able to enter that zone of intense affect. So the word subject also can be used differently. In one of the discussions, we have discussed about the 5 different subjects and the Lacanian idea of a subject. And this idea of a subject is very different from the idea of the self. In a separate presentation, we have dealt with the multiple meanings of the word self in psychoanalysis. So there are many meanings of the word self, many meanings of the word subject, and many meanings of the word object. Today, we will treat the word object as a word to cover all psychological entities towards which or involving which the cognitive and affective processes happen in the psyche. So, in a simple language, we can call all psychological entities as objects, except those entities which are elemental, like affect, like thought, like the evaluation function, like the epistemological functions, except these elemental entities which are elemental to the psychic processes of cognition and affect. All other entities we can relate to as objects. And the relation to those objects can be of different types. There can be a relation to an object in the outer world. There can be relation to the same object in the inner world, which is very different from the one in the outer world. There can be a conscious relation to the object. There can be an unconscious relation to the object, which comes up only in dreams. And we are surprised as to what kind of object relations we have towards the given object in our unconscious. There is also the idea of object being such an entity that it solicits activation of affect and cognition towards itself, involving it. And there is an idea that affect and cognition can move only towards an object, or they can move involved with an object. There cannot be anything like a pure affect. However, if we go deeper into spirituality and deeper into ourselves, we can realize that there is a possibility of experiencing pure affect, and how difficult it is to experience tells us why it is so necessary to deflect pure affect towards an object. The question then becomes, if you feel pure affect without an object, is the entity who feels not an object? The experience tells us that we don't experience that as being towards a representation of ourselves, but there is an awareness of it. So there is no object in that psychological sense. When one experiences pure affect, it is experienced as an awareness, and we recognize it to be something that we call as an affect. So these are the complications related to the two words, the object and the relation. The relation can be cordial, relation can be traumatic. Relation can be of omission, relation can be of commission. Relation can be in the outer world, relation can be in the inner world. Relation can be conscious, relation can be unconscious. So this is about the two words, object relations. And with this elaboration of the two terms, we can now enter into the zone of discussing object relations. See what is the story of object relations. One more important point before we move. Why is it so important to go into object relations as an area? Two reasons. One, as living beings, human beings, most of our problems are not problems with things, but problems with people. Most of our problems are not related to physics or chemistry or biology. They are related more or less in the psychological domain with each other in an interpersonal or intergroup mode. And this is the domain of object relations. So there is a very important macro applied social aspect of object relations. And then we also come to the world of psychopathology, and we realize that a large component of psychopathology is rooted in early life object relations. The type of object relations we had in early life determines to a great extent the type of psychopathology we have, and therefore that gives us an idea how to heal the psychopathology, because healing always will be a function of pathogenesis. If pathogenesis is based upon object relations, obviously healing technique will involve certain things to remedy the effects of early life traumatic object relations. So the study of object relations is very important from a living point of view, from a social point of view, and most importantly from psychopathology point of view. As a species, we are object obsessed species. Even when we are alone, we think of somebody or something. We are constantly engaged with objects from birth till death. So we are actually Homo sapiens objectices. We are object creators. We constantly keep creating objects in the inner world. They may be modified objects of objects in the outer world. There may be completely fantasy objects, or there may be objects as they are in the outer world. But in the inner galaxy, there is always a movie going on of we engaging with some objects or some objects doing something in the inner galaxy. So object relations constantly keeps happening in our minds, and that is the way nature wants it to happen. It is not something we decide. It is not that we decide that from next Monday 4 o'clock we will become object seekers. It is there by default, by nature. So nature wants us to be object obsessed. For what purpose, we are not clear, but we are clear about what it leads to. It leads to three fundamental facts of human psychology. First, human psyche is predominantly human. There is a strong species element to it, that if we are not in danger of attack by any other species, in such a situation, by default, our psyche is geared towards other human beings and not towards any other species or any other entity. So first characteristic of human psyche is it is inclined towards human beings. Second, it is relational in nature. It's constantly relating, either in a cordial way or in enmity, but constantly relating to other human beings, other objects in the inner world. So first, human psyche is predominantly human, it is predominantly inclined human. Second, it is relational. And third, it is comparative and competitive. That we constantly keep comparing and competing with others in our mind. And possibly that is what leads us to the social organization that we have, and that perhaps in some way fulfills some purpose of nature. Psychic activity, which is cognitive, affective, or both, always involves objects in most of us. It's very rare for somebody to experience pure affect or a state of no mind where there is no cognition, or there is no cognition, no affect, no object, and there is a blank mind. These are very rare states of mind. For most of us, all our lives, we experience psychic activity as either cognitive, affective, or mostly it is both of them, involving objects. Object relations we are obsessed with, immersed into from birth till death. One departure here is very important, because the question is, can we get into a psychic state where we are not in the process of object relations? From object relations school point of view, the answer is no. Empirical investigations also suggest that early in life we are into object relations, but there are two departures here, two exceptions. One is Freud. Freud posited the state of primary narcissism before the state of object relations could begin. So that was a state that, according to Freud, is the state most early in life where we experience an oceanic oneness and omnipotence, a self-sufficiency, a grandiosity of primary narcissism, and it's ecstatic. I have explained it in some other discussion how it is not only ecstatic, but it can also be terrifying. the pre-object stage can also be as ecstatic and as terrifying as you see the all good position and the all bad position of the Kleinian paranoid schizoid split, which is of course an object relations phenomenon. So even before the Kleinian object relations can begin, there is experience of positive omnipotence and negative omnipotence without the use of objects in the state of primary narcissism. Indian spirituality also leads us to description and elaboration and even the goal setting of a state of no thought, no affect, no object. And we have discussed before how the state of enlightenment, which is the goal state in Indian spirituality, is very different from the state of primary narcissism of Freud, although there are seeming resemblances from a distance. Object relations are very important because early life object relations and the quality of it is the ground for health and pathology. Not only psychological health, some Kleinians talk even about biological health being influenced by very early life object relations, and even the formation and the functioning of immune system is affected by early life quality of object relations. And of course, only when it goes to the extreme, that depth of pathology institutes itself. There is a very famous paper by Klein, Skin as the Object of Anger. And that also has to do with the quality of early life object relations. It's no wonder that psychodermatology is emerging so fast as a specialty area, because in psychoanalysis, we have always believed that many of the intractable problems are psychologically rooted at its fundamental roots. From an object relations point of view, and we'll come to this again and again, the core developmental task, or one of the core developmental tasks, let me say it this way, is internalization of a good, reliable, stable object, which can happen only and only if the constitution allows it and the environment facilitates it. In the environment, a good, reliable, stable object is adequately present, and there is nothing in the constitution which inhibits or comes in the way of internalizing that good, reliable, stable object. And this, according to Klein, is a very important developmental task of the inner world. Critical to object relations also are concepts of fantasy, the usual fantasies we have, FANTASY, PHANTASY, the unconscious fantasy, and all that we feel towards the objects in the inner world or the outer world or both. We feel love, we feel anger, envy, aggression. The death instinct inside of us comes towards us and we deflect it onto objects. And a very important element in object relations is the capacity to process those events in object relations which generated high amount of affect, or the capacity to mourn the loss of an object. It may not necessarily be good object, loss of any object, including traumatic objects. And all the more important to mourn the loss of good objects. And very important in object relations also is the search for omnipotence. And this is pre-object entity working in the psyche. There is a search for omnipotence, and first it is put on oneself as an object, then realizing it's not done, it's not feasible, it's projected outwards. When disappointed, the projection goes on to fantasy figures, but the search is always there, latent or active. And whenever somebody who claims omnipotence or appears even quarter omnipotent, this search activates and the projection happens. The desire, a very strong desire, remains lifelong in us, the search for omnipotence. That's a very important point in all object relations, or at least the most emotionally charged object relations. So let us look at what are the different types of object relations. The first object relation that Klein talks about is a part object relationship, where the infant doesn't know that the breast is only a part of the mother who is a full object, but the infant relates only to a part of the mother, the breast. So this is a part object relationship. Later on, the infant realizes the breast is a part of the mother and starts relating to the whole of the mother. This is a full object relationships. In the after, once this part object and full object is done, the object relation involves the father, the siblings, friends, and objects around. Objects around may be living or non-living. And later on, it involves the community. Now, when we talk about object relations, we can divide object relations into two parts, broad categories: good object relations and traumatic object relations. Good object relations are those where there is a feeling of security and we are able to establish a secure attachment, a reliable attachment, a good attachment, an enduring attachment. Traumatic object relations are those where we experience either loss or attack or anxiety or any other negative emotion in that relation. And the traumatic early life object relations, they become the basis for different attachment styles, three of which made popular by Bowlby: the hesitant, the anxious, and the avoidant attachment patterns. Underlying these patterns are experiences of difficult early life object relations. So if we go into the process knowledge, elemental knowledge of why these attachment styles have come to exist, we get into early life object relations dynamics. When we talk of object relations, there are four very important concepts we have to go into from a psychopathology point of view. The first and very important concept is the concept of object loss. In early life, if the caregiver is not available for a long time, the child starts anticipating abandonment. And that leads to feelings of anxiety, pain, anger, helplessness, inferiority. So any object loss leads to this. It also leads to a very intense sadness, disappointment, and resignation. Object loss, even in adult life, is difficult to bear. And if somebody has traits of dependent personality or very soft narcissistic personality, for dependent personality, object loss is terrible. For soft narcissistic personality, if he has been attached to some object for a long time and is to some extent dependent, then for that category also object loss becomes very difficult. In fact, if you look at any personality disorder, object loss is very difficult for most of the clients of personality disorders. So one is losing the object. Second is object attack. Object attack. So either the mother is not present, which is object loss, or the mother is present but is not good and soothing, it is attacking. And that leads to anxiety, pain, flight, sadness, anger. Much of it is repressed, cannot be expressed, leading to pathology of different types. So the most important elements in psychopathology involving object relations are the two concepts of object loss and object attack. There is a third element, third and fourth, two more concepts, not as important as 1 and 2. In fact, in 1 and 2, for a long time, I had this question. If you had to select a pathology of object loss or object attack, what would you select? What is more terrible of the two? My initial anticipation was that object loss would be better than object attack because we are saved from the object. We are alone, but we don't have anybody causing us pain. But from a psychopathology point, later on I realized that victims of object loss suffer far more than victims of object attack. And therefore, from a psychopathology point of view, object loss seems to be more terrible than object attack. In real life, however, there are some people who would choose to be alone than to be with a difficult person. And there would be some who would choose to be with a difficult person but not be alone. So some would fear loneliness more than the attack. Some would fear attack more than the loneliness. But from a psychopathology point of view of early life, in general, my experience has been object loss brings about more difficult traumatic outcomes than object attack. It's easier to heal object attack than to heal object loss. Object loss creates a hole which is difficult to fill in. Object attack leads to anxiety, leads to repressed sadness and anger, which are comparatively easier to deal with. Third object, unpredictability. The object is present, may be attacking, may not be attacking, but the object is unpredictable. And what is troublesome is the unpredictability of the object. Now, if the object is attacking and unpredictable, it becomes a deadly combo. But unpredictability itself is a trauma-causing element. And that brings about difficulty in regulation and stability. we can see the dynamic of a combination of attack and unpredictability in most cases of bipolar. That in early life, they had either one of the parent at least, where the parent attacked and was unpredictable. And that led to uh, the difficulties of regulation and stability. The fourth is the search for omnipotence and the constant search for omnipotent object. And this is a very important element of object relations, which is not adequately understood or talked about. That in most intense of our object relations, in the innermost spaces of the inner world, we actually are in search of omnipotent objects. So when it comes to love, we are in search of the eternus femininus or the eternus masculinus. When it comes to power, we are in search of that omnipotent powerful object. When it comes to parent, it's omnipotent parent. And the vicissitude of that gets into narcissism and dependence. So these are very important elements, all the four: object relations, object loss, object attack, object unpredictability, and the search for omnipotence. These four are very important concepts from object relation standpoint. And we see, if you take a pathology, you can see one or more of them at work in pathology, in causation, early life causation of pathology, in fact, chronic pathology. One way to look at object relations is to have this hierarchy. Good object relations, no object relations, bad object relations. There is one group of people who goes by this hierarchy, that I would either have good relations or I would have no relations, but I would not prefer to have bad relations. There is another group of people who goes by this hierarchy. First choice is good relations, then bad relations, then no relations. So this group prefers attack to loneliness. This group prefers loneliness to attack. So if you want to move from here to here, you have to build the capacity of what Winnicott says, the capacity to be alone. So this we find more in narcissistic personalities. This we find more in borderline bipolar. And here there is a constant fear of attack and abandonment. This is actually a very difficult situation in operational terms. Let me say more in volume terms. Now, what can be exceptions to this general flow of ideas? Exceptions are this. If somebody is masochistic, he loves object attack and he actually invites object attack. He might even pay for object attack. Because the relationship template is pain brings love, or pain brings stability, or the pain brings end of unbearable fragmentation anxiety. Or it may be inversion of sadism. Object attack can also be invited if it gives some pain, some concreteness, some solidity to overcome the fragmentation anxiety which would otherwise come up. There are many who are so done tolerating somebody that they actually pray for object loss. So this is also an exception. So in Hindi, we say chutkara.com, that everyone wants chutkara from somebody else. Everyone wants riddance from somebody else. So everyone is saddled with someone and everyone wants riddance of someone. And that is where we actually pray to God for object loss. And this results in a situation called an exceptional situation, profit in object loss. I have discussed this elaborately in a video, profit in object loss. Another exception, if there is fear of love, the moment the closeness gets established, after a point, you pray for loss of the object. If there is fear of fusion, again, the same thing. After a point of closeness, you pray for separation. Or if there is fear of unconscious bad objects activating in some way in closeness, especially in the sexual encounter, then in exception, there may be a desire to be distant from an object. So these are exceptional situations where one wants object attack, one wants object loss, or one wants object distance, reduction in closeness. Let us look at the type of early life object loss. Object loss in early life can be of different types. It may be a real loss, which would be death of the parent or abandonment by the parent, the child being left either in an orphanage or somewhere out on the railway station or some other place. That is real loss and very difficult to fill that hole and all that it creates later in therapy in adult life. And the second loss is the perceived loss. Few people experience a real loss. A real loss when the child is abandoned by the parents, or a parent dies by disease or in a war, or the child is really lost. Most instances of object loss that we come across are instances of perceived object loss. Where the parent is not available for some time for reasons of health or sickness or work or some social emergency, and the child perceives that absence to be an abandonment. And a series of events happens in the mind of the child which are difficult to reverse. So even when the parent appears, after some time, what has happened does not get reversed. And that is where the difficulty is in most cases. Very important is, when does this perceived loss happen? And before this perceived loss happens, what was the experience of the child? If the child has experienced a good, reliable, stable parent, adequately present, for the first 3 months of life. And then the parent goes to work, especially the mother. The mother starts working and the child experiences a perceived abandonment. And these events happen in a way that even when the mother returns back from work, what has happened in her absence cannot be reversed. There is only a partial reversal, and much of what has happened remains, and then what remains builds on the next day and so on. If before the event of the perceived abandonment, the child has experienced adequate and good mother, then more likely outcome is the child will develop a personality disorder or some neurotic disorder. If the child has very early life experience of a perceived loss, say in the first 3 months, or the child never had experience of a adequately good and present mother before the loss, in both these cases, the situation of psychosis is more likely. Constitution also plays a part. If we have a neurotic constitution, or if we have a psychotic character structure, then that also comes into picture in how the pathology will take shape. Equally important is what happens after the event of the perceived loss. So it is not only the event of the perceived loss, but before and after also play a role. Before plays a role in shifting, usually, the category of pathology from psychosis to neurosis or vice versa. And what happens later usually has an impact on the intensity of the problem. So the nature of the problem is more dependent on before and when. When the loss, perceived loss happens, and before it, what happened. So the earliness, so to say, of the event of the perceived loss and what happens before it, that determines in a way, in a large way, large proportion, the nature of the problem, and what happens after it, the intensity of the problem. There is also an element of something intergenerational within the broad area of constitutional. Can the loss be addressed? Can a good object be found? Difficult, but yes. It's not easy to address early life object loss, but it's not impossible. Later on in life, we find good objects, and many of the things which were a problem are worked out with that good object. It can be a good teacher, a good mentor, a good boss, a good spiritual guru, a good motivational speaker, a good friend. We can take example of Wilfred Bion, who underwent analysis with 2 analysts, I believe, long analysis. All that analysis and self-reflection and the experience of life could not help him attend to the some of the core issues which he was able to address only with his second wife. So can a early life object difficulty be addressed? Yes. Is it easy? No. One of the elements of long-term therapy is this, that it allows you to address these issues of early life object loss and early life object attack. Early life object attack you can still address in some cases in more intense forms like ISTDP, but early life object loss is very difficult to address even in any short-term intense therapy. Long-term, non-intense, holding and empathy oriented, more cohesion stance oriented, more safety oriented. These are the therapies which are better suited to addressing loss rather than therapies which are short, intense, and based upon challenge and confrontation. Is it possible that some early life loss, some early life attack just cannot be cured? It may be that there would be cases where the trauma is so deep that no amount of therapy can completely cure it. No amount of medication can completely cure it. And one may have to deal with, even with the best possible efforts of drugs and therapy, with only a partial cure, and the core may remain unaddressed. One of the discussions I have on the channel is titled "Some Stories Can Never Be Told." And in some cases, we may be in this situation where we are dealing with a patient who has a story which cannot be told. We have seen the types of losses. Now let us look at types of attack. So we are looking at problems in object, the traumatic types of object relations. And we said object loss and object attack are very important events in the world of object relations when it comes to causation of psychopathology. We took a look at different types of object loss. Now let us take a different look at different types of object attack. There can be a violent attack, a physical attack. There can be a traumatic attack of bitter words of humiliating words, of scolding, or just terrifying facial expressions or body language. There can be a cold attack when somebody goes cold. There can be an attack of absence where we know the person is in the next room but will not come into this room. There can be a distance attack where the person starts relating to you but makes you feel clearly that there is a distance between the two of you. There can be an involvement attack by too much of involvement, impingement, as Wood calls it. It's experienced as interference, intrusion. There can be a mocking attack. This is deeply underplayed. It's very, very important. I can't emphasize this enough. This mocking attack. The attack of the attack of mocking a child, the attack of dismissing a child, which is what typically the narcissistic or passive aggressive narcissistic people do. Criticism attack. Whatever the child says, you criticize it as not being correct or not being enough, or you bring in a point better or higher than the child's point. Negativity attack. Whatever somebody says, you bring in something negative and spoil the conversation, spoil the mood. The attack of ignorance, or the mirroring attacks that Kohut talks about, the 5 A's: acknowledgement, attention, acceptance, affection, and admiration. The 5 A's. You hold back any of the 5 and it becomes a de facto attack. So there are attacks of omission and attacks of commission, and the 5 A's are what are the mirroring attacks in Kohut's language. So these are the different types of attacks, object attacks. Now let us take a look at 3 examples of pathology and how Freud would explain the root cause of that pathology in his terms, and how Klein would explain the root cause of the pathology in terms of object relations. So we have an object relations causality explanation and a non-object relations causality explanation. Let us take the first pathology, paranoia. In Klein's terms, paranoia is the sickness, disorder, which is because of the split remaining open and there being a constant fear of attack of the bad object because the split is open. And for Klein, of course, the creation of fantasy objects and fantasies around the object is extremely important. The inner world of fantasy, the constitutional orientation of the person which leads to peculiar type of fantasy is very important to Klein. For the Klein, the inside is more important than the outside. So for Klein, the paranoia is the result of the split remaining open and the attack of the bad object constantly being active. For Freud, paranoia happens because of repressed homosexuality. Let us take the second pathology, depression. For Klein, depression happens when there is a loss of the good object. And for Freud, it is anger turning back in situations of losing a narcissistically cathected object. So here we see object relations partly comes into Freud. Does not use the word object relations, but he uses the object relation dynamics. In the first case of paranoia, it's a completely different way of describing it. But here, he comes very near to saying this anger turning back leading to depression. But anger turning back in which situation? He says it is loss of narcissistically related to ambivalently related to object with high cathexis. So this is not couched in those terms, but very near to those terms. Third, mania. In Klein's view, the gain of the all good object makes one feel that the dream and reality have become one, resulting in mania. For Freud, mania would be a result of fulfillment of an Oedipal wish or release of the libido when it is coming out of being blocked in some depressive entity. And it's an unregulated release which is leading to mania. So in situation 1, paranoia and mania, the Freudian explanation is completely different, or rather very distant from Klein's explanation. Klein's explanation is in terms of object relations. Freud's explanation is not in terms of object relations. When it comes to depression, Freud's explanation is partly away from Klein, but does have a tinge of object relations. In personality disorders, you find early life object loss or early life object attack at the core of the pathology. And in most cases, in cases which are most chronic and difficult, it is early life object loss followed by a long period of object attack. I have created a model of personality disorders, how they are caused. I call it the Valley Junction model, and that is based on the idea of early life object loss. So you can see it on my YouTube channel, the Valley Junction model of personality disorders. It is based upon early life object loss. And this helps us to explain why in case of personality disorders, most times we see a mixed presentation. There is a major personality disorder, and then you have secondary and tertiary personality disorders which are attached to the main one. In therapy, the Valley Junction model helps us to understand why we get mixed presentation of personality disorders most times. Now, in therapy, the object relations part is played out with the therapist, because the therapist also is an object and the person is relating to the therapist. So the relating to the therapist in the inner world has the dynamic of object relations, and the patterns of transference will tell us how this object relation is happening. In transference, we can see whether it is a part object transference, a full object transference, transference of an attacking object, omnipotent object. Are we seen as an object of envy, object of greed? Are we seen as devouring, engulfing, robbing, smothering, sadistic, masochistic, narcissistic? How are we seen? So based upon how the person relates to us, what flavor and color the transference takes, we come to realize in the inner world of the patient what kind of object relation is happening involving us as counselors or therapists. In dream analysis, we can see how object relations are occurring. If you want to see more on this, you can see my book on dream analysis. It's available on Amazon. And there I have analyzed the same dream from a Freudian standpoint, from an object relations Kleinian standpoint, from a Jungian standpoint, and from a Eastern psychology standpoint. So you can do a compare and contrast of how you can use object relations approach for dream analysis and how it differs or how it compares to interpretation of the same dream using different approaches. Now, how do we heal difficulties of early life object relations? Traumatic early life object relations healing happens of early life traumatic object relations, primarily one by real life relations. In the relations at work, in marriage, with friends, with colleagues, with mentors is good. It heals to some extent the past trauma. So real life relations is one way which may heal to some extent the difficulties of early life object relations. If the early life object relations difficulty is very intense, this may not be able to break through into the pathological core and create a change, but in most cases, to some extent, it will help heal it. The relation with the therapist is very important. That helps heal many of the past life difficult object relation experiences and also undo the schema which flows from those early life difficult object relations experiences. Therapy work, apart from the relation with the therapist, the therapy work which involves an intellectual and conceptual revisit to the traumatic events, analysis of the traumatic events from various angles, catharsis of blocked emotions, and a profound acceptance of reality. Not that we admire what has happened to us, but we accept what has happened to us and we try to understand why it happened And we try to forgive ourselves and forgive everyone else to the extent possible, and the profound acceptance of reality happens. And all of this, the revisit to the traumatic incident, analysis of that incident, catharsis, and followed by a profound acceptance of reality, which may involve some more mourning and some positivity also. That is the core of therapy work to address early life difficult object relations. Good role models, virtual relations in dreams, fantasies, or art itself, involvement in social work, spiritual work on oneself, all this help us heal early life traumatic object relations. And how much to use what, how to sequence them is to create a holistic healing basket for each individual. Customized, but can be done. Psychoanalysis as a whole area is a tool deficient area, primarily because it developed when we were having 5 sessions a week. So there was no need to go back and do something on your own. But now that we are in a situation, given time and money constraints, we are working usually with 2 sessions a week. At times, even 1 session a week. And this is hardly psychoanalysis. So the necessity of tools has come up in psychoanalysis, but we are a tool deficient area. So if we ask what are the tools in psychoanalysis apart from this, which the patient can use by himself or in a group, or somebody can do it for the patient when he is at home, we don't have really tools. So we have to develop tools to address early life object relations trauma of all types, and tools which can be used by therapists, tools which can be used in a do-it-yourself mode by the patient, tools which can be used in groups by some group facilitator, or the group can use it by itself, and tools which somebody, a caregiver or a friend can use for the patient, or tools which can be used online using technology. So these tools are yet to be developed. Let us reflect on some more ways, slightly more in specifics, of how healing early life difficult object relations is approached by psychoanalysis and by Indian spirituality. In classical psychoanalysis, the healing is done by holding the frame and becoming a good object, and then doing all the classical work of therapy of revisit, analysis, catharsis, and profound acceptance of reality. In the Kleinian scheme, apart from everything else, the idea of exploring envy, greed, primal projections, and transference is very important in setting right all that has gone wrong because of early life object relations. In Winnicott's scheme, it is the becoming of the good enough mother and providing the client optimal frustration. In Kohut's view, it is the holding the empathy and allowing the patient to live out his narcissism. He live out his self-object fantasies. In Beyond's approach, it is the classical Kleinian approach, but with slightly more emphasis on envy, on knowledge, both aspects, K and minus K, love and hate, and most importantly, the ineffable O for healing. For all of this, there are separate videos. You can go in details of it. There is one on Klein, one on Winnicott, one on Kohut, one on Beyond, and one on the ineffable O. So, and of course, the frame of psychoanalysis. So for each of these areas, we have discussed it before, and you can see the FAQ series. And for ineffable O, there is a separate video. So that will elaborate how these things are put into operations for healing the person. And primary part of the healing is healing the early life difficult object relations. In Indian spirituality, there is the approach of idol therapy using idol, and there is a separate video on this, how to create an idol, how to select an idol, how to relate to the idol, what are the phases of relation, and so on. And how the idol therapy can lead to the internalization of a good, reliable, stable object and an omnipotent object. In Tantra, there is a, which is a part of Indian spirituality, there is use of idol therapy, there is use of visualization, there is use of mythology, there is use of real life experiences relating to the guru, and a very special technique called avishkara, which is almost like being someone or playing out someone, which helps you to internalize those activated qualities. And if you want more on idol therapy, there is a series on the channel. You can go into these references to go deeper. One is the book FAQ Psychoanalysis on Amazon.com. Dream Analysis, the second book. Mirror in the Water, it is about narcissism. It talks about early life object loss and the Valley Junction model. Again, a book. And on this YouTube channel, you have videos on Melanie Klein. There is one titled, Melanie Klein will be in the FAQ series. There is one titled Profit in Object Loss. There is one titled Subject called Object. And there is one Freud and Klein, the compare and contrast. So if you want to go deeper in today's discussion, you can go to these resources. Questions, if any, write to me. Thank you.